my viewer. God has given us another chance today to discuss another non-communicable disease. Today we are going to discuss kidney disease. We have two types of kidney diseases. One is acute kidney disease, another one is chronic kidney disease. Now, what is kidney and what is the functions of kidney? Kidney is an organ in our body. Kidney has a responsibility of filtering waste from our blood by removing metabolic waste, by removing any drug, by removing excess iron, by removing excess water to ensure that there is electrolyte and water balance. This is what we call homeostasis. For us to function normally, to feel well, to feel cool, there must be just a normal level of electrolytes, that is sodium chloride, potassium, and even calcium among others. And there must be a normal level of water. Kidney has another function of producing hormone, what we call erythropoietin, which control the formation of red blood cells. Kidney has another function of producing hormones which control blood pressure. So, there may be a situation where the kidney is not doing its work, and this is where we call it kidney failure. So, there may be acute kidney failure, or renal failure, or chronic renal failure. Now, what may cause kidney not to do its work? One is diabetic mellitus. Two, hypertension. Allow me explain for clarity purposes. There may be some health conditions which interferes with the function of the kidney. Within the kidney, we have what is called nephron, and we have what we call glomerular. These two organs attached together filter all chemicals in our body, in our blood, filter anything which is a waste, filter excess iron, filter excess water to ensure that what I've called homeostasis works. But there may be a condition which has interfered with the nephron or interfered with the glomerular. And one of them is what I've mentioned, the fact that somebody has hypertension. The pressure of hypertension interferes with the glomerular, interferes with the nephron function. And so hypertension precipitates a normal kidney to failure. Two, diabetic mellitus. Diabetic is associated with hypertension. Apart from that, uncontrolled diabetes precipitate what we call atherosclerosis. Within the arteries within the kidney have clusters of salt, have clusters which is interfered with. It is drying the blood vessels within the kidney, and this also precipitates kidney not to function. Use of analgesics, specifically this drug is called brufen. Most analgesics, including brufen, one of the worst, interferes with the kidney function. There may be growth, what we call congenital growth of a cyst in the kidney. And in the occasion, there may be infection, and one of the infections which have been found through research is pinworm. Any infection which interferes with the kidney may precipitate kidney to a failure, whether it is chemical or what. So this is what we call renal failure. I've mentioned what causes renal failure. I've mentioned the function of renal failure. How do you know whether you have renal failure or not? Scientific way of knowing whether you have renal failure is to be screened. In the medical field, we have routine screening of non-communicable diseases. It is advisable for you to go. In the screening, they will find that in your urine, there is a production of protein which is not supposed to be. When there is protein in your urine, the doctor will suspect their glomeruli is not functioning well, and they will find out why. When they test your blood, there will be excess creatinine. Your blood vessels, your bloodstream should not have creatinine, especially that exceed 3 milligram per deciliter. So, in other words, it is the medical professional who will establish to you whether you have whether you have chronic kidney disease or not. Also, with you, you may detect that sometimes your lower limbs swell, like a pregnant woman. Sometimes you may develop anemia. And those two conditions, since they are related to other factors, it may confuse you. So it is only my advice that if there is any history of hypertension, if there is any history of somebody with kidney disease in your family, if there is any history of diabetic mellitus, if there is any history of cardiac condition, it is advisable for you to be doing screening as regular as possible, especially those who have attained the age of 40 and above. Because chronic kidney disease, apart from those who might have developed acute, there is a situation where somebody develops acute kidney disease, especially pregnant mother. Their hypertension during pregnancy may make them develop what we call eclamptic fits. And eclamptic fits, the kidney is interfered with because of that high blood pressure, and this lady is losing a lot of protein through urine. But in such a case, that is a rare case. The one I'm trying to address here is chronic kidney disease. So, how do we help? Almost all non-communicable diseases have one approach, is that prevention is better than cure. One, control your blood pressure. Because, as I said in one of my articles, that blood pressure may interfere with the functions of the nephron and the glomerular and may precipitate this. So if you control blood pressure, you are controlling not to get chronic kidney disease. Avoid analgesics like brufen. They interfere with your kidney and they may end up making you suffer kidney disease. Control diabetic mellitus in case you have diabetic mellitus. Ensure that you control it bare minimum to avoid precipitating chronic kidney disease. And control cardiac conditions. These 3-4 conditions are sisters. Where there is hypertension, chances that there will be diabetic mellitus are high, chances that the kidney may suffer, chances that the cardiac condition may be there are high. So try to control hypertension to the level you can. Or it is advisable to search this thing when you are still young. Don't wait until you are diagnosed, because once you are diagnosed, sometimes it will force you that now it is the drug helping you. But if you change the lifestyle, which we have talked, and it is one thing I repeat day in, day out, that you do exercise, you reduce salt intake, you reduce sugar intake, you reduce fatty diet intake, and replace with a lot of vegetable intake and fruit intake. These things should be your habits, should be your culture to prevent this. Don't wait until you develop this condition is when you start struggling, because management of chronic kidney disease is not a joke. Because once diagnosed, if it fails, kidney transplant, you may not afford it. Dialysis, most of us cannot afford. So the better you prevent kidney disease by changing your lifestyle, and most of the things which I've been discussing are more or less repetitive: exercise, diet, exercise, diet, exercise, diet. Avoid alcohol, avoid tobacco, exercise, diet. In other words, non-communicable diseases have one approach. If somebody is disciplined enough and listen to me early enough before you develop, the better. If it is genetically inherited, we pray that God will give us the strength to control it. Otherwise, Thank you for listening today. We'll discuss next time. I'm very sure that my articles are not exhaustive in the fact that some areas, gray areas which I've not mentioned because of time, also interferes. But God will bless us. We'll have another time to discuss another non-communicable disease. Thank you so much. God bless you as we meet next time. Asante sana.